guys, welcome back to my channel. So on this day I decided to perform a micro needling procedure on my face. Since I have the machine at home, I said why not. So for those who don't know, micro needling is a skin rejuvenating procedure which helps to stimulate blood cells production, thereby increasing blood flow to the face or to the area where the procedure is being performed. This procedure also deeply exfoliates the skin. It is good for people with hyperpigmentation and dark spots. Also very great to tighten the skin and promote youthfulness. So this is me showing the products I was going to use on my face. For this procedure, all you need is the machine, the microneedling machine, which is called Doctor's Pen, and the serum you'll be using. Hyaluronic acid serum is mostly used, or any other water-based serum can also be used. So I already washed my face and I was trying to wipe off any excess oil just to make my face fresh, because the first step is to apply a numbing cream which is called EMLA, or any other numbing cream, but mostly the most common one is EMLA. So I just made sure I was wiping off any excess, any other deaths on my skin. I already washed my face. So those who know me know I recently had a baby, and during my pregnancy I developed lots of hyperpigmentation, dark spots, sunburn. I wasn't going under the sun, but yet I developed sunburn. It's really funny. I'm someone who hardly had sunburn, but this happened. Pregnancy stuffs. So this is the EMLA I was about to use. It is recommended to use 5% EMLA. Mind you guys, this is something that you should do only when you are an expert, or when you know how to do, or only when you are a beauty therapist or dermatologist, or an aesthetic physician, or a dermatology nurse, or a skincare specialist who has done a lot of research and is licensed to perform stuff like this. You shouldn't just get up one day and just buy this thing and start doing without being supervised or by someone who is an expert, you know. So I just apply the EMLA with a wooden stick. Normally for patients we usually put on gloves, or for clients we put on gloves. So this is for myself. So I didn't see the need to put on gloves, but caution is you should not let it touch your hand, because whatever area the cream touches, that area gets numbed. So I believe you don't want to numb your hands, the hand which you are going to use to perform the procedure. If you numb it, you will not have sensation. This is how powerful this stuff is. Yeah. So like I said, you should not just jump into this kind of procedure without being supervised, or without being an expert, without knowing how to do it, because it's not a regular kind of thing. It's a procedure performed once in a while, only when you have a skin issue you're trying to treat. Yes. So this EMLA has to be left on the skin for about 10 to 15 minutes, and in some cases even up to 30 minutes, depending on the type of needle about to be used, because there are many types of needles. You saw the machine, the microneedling machine. There are needles we attach to the machine, like we fix on the machine and use. So these needles are of various lengths. So if you're about to use a longer needle, you have to let the numbing cream for a longer time, since the longer the needle, the deeper it will go into your skin. Not the regular needle. I'll be showing you guys the needles in this video. So the needle gauge starts from 12 up to even 36 and beyond. So the smaller the number, the longer the needles. So the 15 minutes was done, and I was about to go wash off the EMLA. Yeah, I see I was taking it off here. So before you know it is ready, you need to test by trying to prick or pinch the skin to see if the patient will feel it, or you yourself, if it's on your skin, to see if you will feel the sensation or you will feel pain. So here I had washed my face already and taken off the EMLA. So for this video I decided to use the shortest needle. So this is the needle. This is how it looks like. 36 needle. Yeah. So this is the machine, and I had already fitted the needle. And this is the serum I had extracted in this 1 ml syringe. This is the machine. Okay, here, this is where I fitted the needle. This is how it looks. This is me here fitting it. Yeah, and after fitting, I'm going to switch the machine on, testing it. Yeah, test the machine. Yeah, first you need to switch on, test, regulate it before touching on your skin. Yeah, this procedure can also be performed on any part of the body which is affected by pigmentation or maybe stretch marks, or any area which you want to rejuvenate or increase blood flow to that area, or fade a dark spot, or fade hyperpigmentation. Yes, but like I said, you shouldn't just start doing this without being supervised or without being an expert. Yes, so this is me here. So what you do is you apply the serum on the affected area and then regulate the machine to the length you want the needles to surface, to penetrate. Then you could see me regulating the machine so many times. In some areas, like areas that have bony premises, like the forehead, you will not use the same needle. You will not use the same needle length, like areas like your cheeks, which are softer, or your chin, which is softer. Yeah. So in the bony areas, I had to regulate the needles to the lowest. Like I said, you should know how to use this before you tamper. Otherwise, you end up bruising your skin. Yes. So where I worked previously, I usually do this there on the patients. Yeah. And I used to pay also and do for myself. But I decided to buy this machine, to minimize the cost of always having to pay, since I know how to do it. I said, why not, invest in this and get your skin rejuvenated anytime you want at home. So the only challenge is always getting a good serum, because you can see it's not something you just get any serum. The serum used for this procedure is quite costly. But in medical or cosmetic centers, or clinics, they sometimes substitute these serums with blood plasma. They extract your blood, centrifuge it, and remove the plasma part, and the liquid part of the blood here, and they use it to perform this procedure, which is very okay. This is to minimize the cost of serums, because the serum used for this procedure is expensive. You don't go for cheaper serums. Since you are bruising the skin, you should be applying something rich so your skin benefits. And this machine helps to push in the serum, and you see great results. The good thing is when you are doing this by yourself or at home, you'll be generous with the serum. You'll be generous with the serum. It will not be economical, because when you go to these centers, they'll be economical, because they will use according to your money. Yes. So when you are doing it on your own at home, you have advantage. So this is me repeating on the areas where I have this sunburn. So this helps to also scrape off these dead cells, skin cells. So when I apply the cream I'm using to fade this hyperpigmentation, it will work easily, since the upper layer of the skin has been scraped off, and leaving the skin softer for products to easily penetrate. After this procedure, you will start seeing results on your face or on the area 48 hours after the procedure. Up to 4 days. In some cases, it might take up to 4 days, because the skin, depending on how much the skin was bruised. Like I said, this needle I'm using is a 36 needle. It's very mild. In some cases, when a longer needle is used, like the 12 needles, which is longer, it bruises the skin very well. You might see lots of blood flowing on the patient's face, which is okay, which is very okay. So in this case, I just wanted to make it applied because my pigment is really much. So, and since I have the machine, no need to prick a whole lot from the first try, yeah. So I can repeat this procedure every 2 weeks until I get the desired results I want. Yeah, that is why I didn't want to first day just bruise my skin like that. Yeah, because I purchased this longer and shorter needles, so I can use whichever one whenever I want. So on this procedure, I will not show you guys the after results now, but in a later video I will show you the after results. After I have performed like 3 sessions, then I'll show you the after result. This is the first session. You can see my face is really rough in this first session. Yeah, but I will see lighter results after this. The second session is usually more effective. So if the target is to treat hyperpigmentation, by the third session you should have seen results. Like your skin should be done, everything should be okay, the pigment should have gone, faded. So the advice would just be to continue applying your hyperpigmentation products. Yeah, because this procedure bruises the skin, it's not advisable to always do it like on a regular. It's good to give a break. You could do 3 sessions. The first 2 sessions could be done every 2 weeks, and then the third session after a month, and then you give a break for some months before trying this again, because this bruises the skin, so you don't want to be bruising your skin every time. Yeah, so this procedure is really good if you're using the right serum. Like I said, you see results also based on what serum you are using. Yeah. So excluding the MLAS step, this procedure normally takes like 10 to 15 minutes. Yeah, it's not something that you do for the whole day. Like, you shouldn't be scraping your skin for more than 10 to 15 minutes. Yeah. So you see, I'm not feeling any pain because of the MLA I applied. Otherwise, nobody will put needles on your skin like this, and you will not feel pain here. Yeah. So this is me. I was just rounding up here. I had basically touched every part of my face. Like I said, I was just trying to, the first step, trying to be mild, to be gentle. Yeah, that's why I didn't use the longer needles. After this procedure, you should not wash your face for up to 6 hours, because this serum has to still sit on your skin, penetrate into your skin, and then give it time to work. It's advisable to even go to bed. It's advisable to do it in the evening and go to bed with it on your face for maximum results. Because like I said, this serum is very expensive. It's not just any hyaluronic acid serum, yeah? And it must not be this one I'm using. There are a list of the types of serum you can use. There are some products you will use, some serums you will use, and you'll be feeling tingling sensation. Yeah? So you should know which type to use. Like I said, it's not something you just jump into doing at home. You should contact an expert or someone who knows this, or an aesthetic or a beautician. Yeah. So after this procedure, your face, you might experience some dryness, some flakiness, like your skin will be so stretched. Yeah, because you have scraped the skin, so your skin will look so stretched and shiny, and some areas might start peeling off slightly, not much, not like a chemical peel, just slightly. That is the exfoliation I was talking about. This procedure deeply exfoliates the skin, so some dead cells will fall off. Afterward, you see them physically falling off. Yeah. Yes, so don't wash your face, guys, in case you do this, so as to get the maximum results. Yeah, the serum has to work, and after this you have to continue applying this same serum on the affected areas, or any other serum that which you are using to treat the hyperpigmentation. And like I said, if you repeat this procedure 2 to 3 times, you should have gotten your results. Okay, so thank you guys for watching this video today. And so here I was just rounding up. So if you are new to this channel, kindly subscribe to join the family. Also give a thumbs up to this video if you enjoyed watching it. If you're a returning subscriber, thank you for coming back to always watch my new videos. And if you have any doubts, kindly leave a comment down below and I'll clarify you. If you plan to do this procedure at home, also leave a comment and I will let you know on whatever doubt you want to clarify or how you can go about it to also become an expert on how to do this procedure. So thank you guys, and I'll see you guys in my next video. Subscribe if you haven't. Thank you. Bye.